Wow, what a turnout. People really know how to show up. It's so good to see everyone. Good morning. My name is Jade Thomas, and I work as a policy specialist at All Our Kin.
And I'm Mary Oster. I'm the Early Childhood Coordinator for the City of Norwalk. And together we are co-chairs of the Connecticut Early Childhood Alliance.
I want to thank the Early Childhood Caucus and the Connecticut Association for the Education of Young Children for co-sponsoring today's event.
And this week we celebrate the Week of the Young Child, disconcerting news from Washington, and a real opportunity here in the state of Connecticut. We want to thank Governor Lamont for issuing this official proclamation naming the Week of the Young Child in Connecticut. Hey, right?
To give us an update on the news from Washington, I'd like to introduce David Morgan, the Executive Director of Team Inc.
Let's give a big hand to Jade and Mary and the Early Child Alliance, their leadership. They have been trailblazers, and I've had the pleasure to watch the Early Child Alliance for multiple decades. So let's give these two a big hand. My goal is to give you an over-summarized summary of what has happened at the federal level, and more specifically what it means to the early childhood system in Connecticut that Connecticut is trying to pour itself into. And I've been introduced as the Executive Director of Team Inc., arguably one of the largest early Head Start and Connecticut early childhood providers in the state of Connecticut. But I would be remiss to tell you how much I personally, there's some powerful stories. I have the pleasure to introduce a parent very shortly. I graduated from the University of Connecticut with a degree in early childhood. I'm born and raised in Connecticut. Love this state. Met my wife at the University of Connecticut, and she poured herself into early childhood as well. And my vocation, my roots started as an infant toddler child care worker. And again, I'll skip my story of self in the interest of time, but as you can imagine, Christy and I and my kids, and more importantly, this field for families and children in Connecticut, it didn't end well for us because we had a double dose of a currently broken early childhood and child care system. We were both workers in a child care system that does not compensate it. In fact, it pales in comparison to, I can make more money going to average DOL, Department of Labor data, I can make more money dog sitting than I could doing God's work with our most incredible emergent human beings called young children. And we had 3 kids and raised our kids here in Connecticut. And this lack of an adequate national investment and what Connecticut is trying to pioneer for this beautiful country, it really falls on the backs of families being asked to pay tuitions that rival or exceed their rent or their mortgage. And it falls on the backs of our workforce getting paid garbage compensation. Forgive my candor there. I'm going to tell you very quickly about the federal piece. 8 days ago, and again, close to 500 young children in Greater Waterbury, Lower Naugatuck Valley, South Central Connecticut, from Milford all the way up to Waterbury and beyond, including integral partnerships that we have with the Connecticut Office of Early Childhood, with their Early Start initiatives, beautifully braided programs that serves over 500 young children and families, and that includes unprecedented expansion of infant toddler capacity, that moms, dads, primary caregivers, our vibrant workforce, we're trying to attract our workforce, they are screaming for capacity at infant toddler as well as age 3 to 5. I got an email from a federal worker in Boston, again, 8 days ago, saying we are gone today. The entire Administration for Children and Families in the Boston office has to leave today. We've learned this through an email. What this means for Team Inc., and this is not unique to us, this will be a reality for all early childhood providers in Connecticut, is we've been going through a 90-day process. Team Inc. is a May 1st federal grantee. Remember, Head Start and Early Head Start is direct federal to local. Federal government, the budget runs October to September. It's not operationally conducive to manage 1,000 Head Start grants across the country on one cycle. So they layer them across 12 months. So Team Inc. in this South Central section, state of Connecticut, and 500 young children and families, its grant deadline is May 1st. It's a 90-day process, so you submit everything programmatically, financially, local community need, what are families asking for and needing for. And again, we provided unprecedented capacity on infant toddler care as well as preschool age. 8 days ago, they're leaving, the people we've been working with, and they said, we hope you have somebody who can bring this home and connect with you. Perhaps you'll hear more from Washington. And again, that's 8 days ago. You add this layer of uncertainty and chaos, again, on top of a broken system. 2 days later, we got the formal notification from the Deputy Secretary of HHS saying that they've consolidated 10 of the regional Head Start early childhood offices from 10 to 5. So that includes Boston's gone, New York is gone, Chicago's gone, Seattle's gone, San Francisco's gone. We know how sparse it is in northeast portion of this country. I'm being a little cheeky there as far as Head Start grantees and population density. And so we are facing a major crisis here approaching May 1st. I do believe we will turn the corner. We are being very tactical on connecting through documented systems, albeit they're quite broken and convoluted. When you don't have human beings administering these programs, it creates unbelievable levels of chaos that, again, falls on the backs of our families, children, working families, and on a workforce that is already hemorrhaging due to 50-plus years in the making of a lack of a national public investment in this. So my big, takeaway for this is Connecticut, no one's coming to help you. And I say that with love, and I say that with admiration, what I said at the beginning. I'm still in the field of early childhood. I'm at a significant point of authority and privilege to do my small part for the cause. And I believe this session, and kudos to the Children's Caucus, our very own Representative Wielander, Farrar, and many others. I got to highlight Wielander, who's really in the front line in some of our local communities, and many other legislators, and seeing and hearing the governor's commitment and the lieutenant governor. Again, we can look back at this session and say this was a legacy moment. This was a moment where Connecticut and this country can learn from. We need a national bill, a shared economic, social, environmental, educational responsibility towards this prenatal to age 5 that can be transformative. In Connecticut, you can be the vanguard based on what you co-create together within the Connecticut General Assembly. And that is very inspiring. And so forgive my long-windedness. Please know nobody's coming to help with the federal. This is only the beginning of a very chaotic, uncertain, lack of attention to what matters most, our prenatal to age 5. Absolute transformative. And with that being said, a couple of stories here. I have the privilege, whatever that means. I have the privilege, try not to cry, folks. It's how you look, staff and families in this. We might be here May 1st, we may not be here May 1st. And then when we get through that, we may be here in October, we may not be here in October. And forgive me, you see, I'm singing to the choir here. Real privilege for me to introduce Jennifer as one of 3 stories of self that I hope we all walk out of here and think about the story of us and the story of now, the sense of urgency. Connecticut can be the difference. Let's give a round of applause to Jennifer.
Jessica, would you be able to come up? Thank you.
Jessica.
Good morning. My name is Jessica Springer Cap, and today I'm going to read on behalf of Enes Castro. She couldn't be here today. It's pretty powerful. I already read it, so let's get. I'm a proud school teacher at Manchester Public Schools, where I've been teaching for over 3 years. I'm also soon to be a first-time mom, just 3 months away from meeting my baby, and I couldn't be more excited. This new chapter fills me with joy and anticipation, but it also comes with a heavy question that weighs on my family every day. How will we afford childcare? As a first grade teacher, I provide the best care and education I can to my students every single day. I know firsthand how important those early years are, and I want to give my baby to receive the same quality care and attention that I give to my students. I deeply value the work of childcare providers and early educators, and I understand that quality care comes with a cost. But right now, that cost is simply out of reach for my family. Like many young professionals with established careers, my husband and I don't qualify for state subsidy programs. That leaves us with impossible choices. One option I'm seriously considering is stepping away from my job, a job that I love, to stay home and care for my baby. So here's the truth. Being a stay-at-home mom isn't something I can actually afford to do either. I have student loans that take up nearly half of every paycheck. That debt doesn't just pause just because I'm starting a family. It's why I'm also weighing the idea of leaving my career during the day and finding part-time work in the evenings. Not to help cover childcare, but just to keep up with my student loan payments, cost of living, and keeping food on the table. This is not the life for me or my husband envisioned when we worked hard to build a career and prepare for parenthood. But it's the reality for so many families in Connecticut. Right now, my own mother is preparing to step in and help with childcare. But that means she has to leave her job too. Someone always has to sacrifice. And it takes a toll on the entire family's income, stability, and ability to stay in the workforce. I'm encouraged to see what this year's legislative session includes a strong focus on addressing childcare. But while the governor's universal pre-K proposal is a step in the right direction, it doesn't meet the urgent needs of families like mine, those looking for infant care or affordable options before a child turns 3. We need solutions that reflect the full reality of what families are facing. We need access to affordable, high-quality childcare, no matter the age of our children. For the sake of my family and so many others around Connecticut, I'm asking legislators to be bold. Fund childcare solutions aggressively. No more Band-Aids. It's time for real investment because our families and our future can't wait.
Good morning, everyone. My name is Janelle Jensen, and I'm a dedicated childcare provider for the Greater Waterbury YMCA. I'm also a proud mother of 3 young children, 2 of whom are with me today. My twin girls, Isla and Leah, 4 years old, and one of my children is currently enrolled in an early to school-age childcare program at the Y. That's very well served. I've been employed with the Waterbury YMCA for the past year and currently hold 6 early childhood education credit hours, along with a child development associate credential that qualifies me to work in this field. I'm actively working towards obtaining an additional 6 ECE credits to reach ladder levels 13, which is Connecticut's early childhood career ladder. After spending several years in the nonprofit sector, I made the decision to transition into early childhood education. I recognized a growing need for passionate, qualified professionals in this field, and I felt called to step in. Not only was there a demand for more educators, but I found true joy and fulfillment in working with young children and helping them grow. While I love the work I do, the financial realities of this career are incredibly challenging. I'm fortunate to receive health insurance through my husband, but for many of my colleagues, coverage through programs like Husky is essential due to the high cost of health insurance. Unfortunately, compensation in our field remains very low. In Connecticut, many early childhood educators earn just above minimum wage. And that makes it difficult to attract and retain quality teachers who are vital to a child's development. I have colleagues that have to work a second job just to make ends meet. I'm encouraged to see that legislation has been introduced to support higher wages for early childhood educators. I sincerely hope that lawmakers in Hartford will prioritize our industry, not only to support the professionals who care for and educate our youngest learners, but to ensure children across our state can thrive and succeed academically. And now I'd like to introduce a family child care provider from Waterbury, president of CSEA Local 760, the Family Child Care Union, Maria Reyes. Maria. Thank you.
Muy buenos días, mi nombre es María Reyes, soy proveedora de cuidado infantil en el hogar y presidenta del Sindicato de Proveedoras Infantil Familiar, ECIU, local 201. Me orgullece representar a miles de proveedoras de aquí de Conérico y aquí presente. Estoy aquí hoy para alcanzar mi voz y toda la voz de todas mis compañeras y educadora, dedicada a trabajar cada día en el bienestar de los niños, las familias y nuestras comunidades. Pero hoy podemos seguir haciendo, no lo podemos seguir haciendo sin el apoyo necesario de ustedes. De los muchos cambios importantes que esperamos, quiero enfocarme en dos roles que puedo esperar. Primero, pedimos su apoyo para aumentar la capacidad de los niños a 12 más grande, permitiendo que cuidando hasta 12 niños, esto nos ayudará a servir a más familias y a ofrecer mejores salarios a nuestros asistentes. Es algo urgente. Mientras el costo de la vida siga aumentando hoy, las asistentes no pueden tener el salario mínimo suficiente y no podemos pagarles realmente lo que merecen los asistentes. Segundo, necesitamos acceso a un seguro médico accesible de calidad. Nuestro cuidado infantil está cada día con nosotros, impropio de la salud con frecuencia. Dejamos sin ningún tratamiento a la proveedora, simplemente porque no podemos pagarlo. Estos no son temas nuevos. Nuestro sindicato ha luchado por estos cambios por más de muchos años y ganamos nuestras elecciones. Ahora estamos más cerca que nunca de lograr este cambio real. Pedimos más inversión estatal en el cuidado infantil, que se invierta en nosotras, porque invirtiendo en el cuidado infantil es invertir en el futuro de Conérico. Ahora lo voy a introducir con el representante Willander. Gracias.
Gracias, Maria. I will be interpreting. Good morning, legislators and community members. My name is Maria Reyes, and I am a family child care provider and the president of the Family Child Care Providers Union. I am proud to represent CSEA SEIU Local 2001 and providers and thousands of providers across Connecticut. I'm here today to raise my voice on behalf of the thousands of dedicated educators who work every day for the well-being of children, families, and communities. But we can't continue to do this work without the support we need. Of the many important changes we hope to see, I want to focus on two that can no longer wait. First, we are asking for your support to expand large family child care programs, allowing us to care for up to 12 children in our homes. This would help us serve more families and offer better wages to our assistants, something that's urgently needed as the cost of living keeps rising. Right now, assistants often earn more than we do. And even then, minimum wage is not enough. We simply can't pay them what they truly deserve under this system. Second, we need access to quality, affordable health insurance. We care for children's health every day, but many of us can't care for our own. Too often, we go without important treatments simply because we can't afford them. These are not new issues. Our union has been fighting for these changes since the day we won our election, and now we are closer than ever to making real progress. We are calling for this greater state investment in childcare. Invest in us, because investing in childcare is investing in Connecticut's future. Thank you.
done. Well said. Thank you. Good morning. Good morning. I'm Representative Mary Wielander, and I have the privilege of serving as the chair of the Early Childhood Caucus, as well as the vice chair of the Children's Committee, and serving on education and the Select Committee on Special Education. Thank you to everyone here today. This is an amazing turnout. I'm so grateful to see so many people to be here for this important conversation. We are so lucky to have heard from teachers and providers, parents and advocates telling their stories, and thank you for sharing them with us throughout this whole session so far. If you've been paying attention to the bills proposed this session, you will have seen the multiple major pieces of legislation that are working to address the crisis in childcare and early education. While it can be tricky keeping track of the details, it is heartening to see the attention being paid to this issue. From House Priority Bill 5003 to the Governor's Bill to Senate Priority Bill number 1 and the many, many other proposals that look to make a difference in this field, they are reflecting the importance of these conversations and doing this work now. So let's talk about the real-life impacts of the lack of quality childcare and the insultingly low wages that accompany it. Women are the economic drivers of our society, but we are also the most vulnerable at times. In 2022, a study by the TIAA Institute found that women on average had 30% less saved for retirement than men. Another study by the Census Bureau found that in opposite-sex couples, the annual wage gap between men and women doubled after the birth of the first child to over $25,000. And roughly 32% of women never return to the workforce. And I know these statistics personally. I am the mother of 3 children. I stayed home because we could not afford childcare. I worked in a childcare center for very, very little. It was an amazing opportunity, and I'm so grateful for that chance. But I was home for 13 years because I could not get a job, and getting back into the workforce is incredibly challenging once you've been out. And on top of that, if you can't work because you can't afford or find childcare, then you aren't paying into Social Security. You are not able to contribute to a 401k. If you are working but only being paid a fraction of what can be earned in other professions, then you aren't able to save at all. Women are also living on average 7 years longer than men, meaning that our smaller savings have to stretch even further. And these statistics don't fully recognize the earning disparity that impacts women of color. If we want our economy to succeed, then we need to ensure access to a variety of quality health care and early childhood education. Early childhood education opportunities that meet the need of each community. If we want our families to succeed, then we have to address the unsustainable rising costs of health care. Of that care. If we want our communities to succeed, then we have to pay our providers a wage that reflects the importance of their roles and empower the women behind this industry. These are not challenges with easy solutions, but the success of our state and our children is at stake. The time is now. It is now my absolute pleasure to introduce my colleague, Representative Kate Farrar, to discuss House Bill 5003, which she has been working tirelessly on. Thank you.
Good morning, friends. Good morning. Seems like a good morning to invest in childcare, isn't it? Yes, it is. Good morning, everyone. I am State Representative Kate Farrar. I proudly represent the 20th District of West Hartford and Newington. And as my good colleague, Representative Wielander, shared, I am proud to lead our House Priority Bill on Childcare 5003. But before we get to that, I just want to acknowledge what we heard at the start of this press conference. I don't know about you, but it's hard every day to kind of keep up with the emotions of what it takes when the Trump administration, day after day, is attacking Connecticut's children. One day it is rescinding funding to feed our children who are in need. The next day, it's rescinding funding to immunize our children. And just lately, as you heard, it's closing the key offices that support Head Start, the most essential care for our children and families in the state of Connecticut. I think this moment and the attack that our children and our state are under simply accentuates our responsibility, all of us as legislators in this building today, to meet not just the need that has existed, but to invest in the future. Because we know the greatest investment is in our youngest children. And the greatest investment is in all of you for the care that you provide to our children. There are incredible bills, as Representative Wielander shared, from the governor's office, from the Senate, and our own House Priority Bill 5003 this year. It's a great thing that we have so much attention on the desperate need for more affordable and accessible childcare. What it takes now in these final 2 months of this legislative session is that we first make the ongoing investment that's needed into the Early Childhood Care and Education Fund so that we have the dollars needed for caring for our children, for supporting your pay and benefits, and for supporting the long-term cost of care. It's why in House Bill 5003, we're so focused on lowering costs for families. Here in Connecticut, we have the 5th highest cost of childcare in the country. It's why in House Bill 5003, we look to increase access to Care for Kids, our child care subsidy, so that more families can lower that cost of care. Secondly, in House Bill 5003, we seek to address the needs of you, so many of our child care educators, because if there's anything we walk away from today knowing with this full room, it's that it's not just about the kids. It's about the people, you, primarily women of color that are caring for our kids. And that's why in House Bill 5003, we look to create a process to not just increase your pay, but to also provide a health insurance benefit with a subsidy on the Access Health Exchange. And finally, the third key component of House Bill 5003 is treating childcare like the infrastructure it truly is, putting the bonding in place year after year so that we can make the capital improvements that your childcare facilities need and build more childcare facilities that our families and communities need. I don't know about you, but we have to hold on to this energy, this passion, this commitment that we're making in this room today. And I know for so many of my colleagues that are here, Representative Shake, Representative Arzano, Representative Hughes, Representative Comey, and Representative Wielander, and so many more, we are committed to doing the hard work, to making the decisions that are right by our kids, by our families, and by our businesses. So let's make it happen. Thank you, everyone. I can't leave the mic because I missed two of my other colleagues, Representative Gauthier and Representative Morin-Bello. Thank you.
Thank you. I'm Merrill Gay. I'm the director of the Connecticut Early Childhood Alliance. Today we've heard troubling news out of Washington about cuts that are impacting Head Start and could impact other early childhood programs as they work through the budget process. We've heard three different perspectives from a parent, from a center-based child care teacher, and a family child care provider, and we've heard from some of our champions here in the legislature. This year there are three major bills that would transform child care. The first comes from the governor about universal preschool. Then there's one from the Speaker of the House, 5003. And then there's one from the Senate leadership, SB 1. There are things in all of those bills that we like, and we know that the negotiations among those three power centers are just about to start. So I want to say as clearly as possible what the Alliance supports. The Alliance supports high-quality early childhood education for all of Connecticut's children. That means more subsidies to make care affordable for families and investment in facilities to grow the system. Early care and education must be provided through a mixed delivery system. That means not all in public schools, not all in centers, but families ought to have the choice of whether I want to put my children in a family child care, in a center, or a school. And as we work to make preschool universally available, we need to be very intentional to bolster the infant-toddler care system. There are far too many examples of other cities and states that have tried to do universal preschool quickly and have managed to muck it up and decimate the infant-toddler care system. So we need to intentionally strengthen both at the same time. Key to quality early childhood education is investing in the early educators working with children every day. On average, early educators earn some of the lowest wages in the economy. Many work for minimum wage without any benefits. Programs would like to pay their staff more, but they simply don't have the revenue to do it. Parents, their customers, can't afford to pay more, and that's why the government needs to be part of this equation. Early educators need better pay, health coverage, and care for kids coverage to pay for care for their own children. I've talked a lot about child care, but Connecticut families need it to both be affordable and, in addition to child care, we also need a refundable child tax credit. Finally, I have to say a few words about Medicaid, or Husky as we know it in Connecticut. The threats to Medicaid from Washington are dire. The threats, we can't let that be a reason why we don't do what's right here in Connecticut. We need to address the rates that have been stagnant since 2007. Those stagnant Medicaid rates have been strangling the birth to 3 system. We've already lost 2 providers this past year, and we need to address that so that we can strengthen that early intervention system. And then we also need to address the fact that children who have a medical need for diapers aren't able to get them through Medicaid when adults can. So we need to have that parity in the system. So I'd be happy to answer any questions from the press, if there are any. Okay. And now it is time for all of us to go over to the Capitol building and talk to legislators. I want to make sure that everybody stops by the Lakeshore Learning mini preschool classroom at the top of the escalator. If you've brought kids, yes, they can go play in that space. We want them to enjoy it. And I'm really excited about all the people who are here today. Let's go out and talk to legislators and make them understand why it's important that they get something done this year. Thank you, everybody.